Do you know what are the common causes of chronic cough with a normal chest X-ray? The most common cause is post-viral upper respiratory tract infection, in which cough persists for weeks after resolution of viral URTI. There is no fever or systemic symptoms. It is self-limiting in most cases. Next is upper airway cuff syndrome, which is also known as post-nasal drip. It is associated with chronic throat clearing, sensation of mucus dripping in the throat. Gastroesophageal reflux disease, cough often worsen after meals, at night or while lying down. Regurgitant symptoms might be there and it respond to PPIs. Smoking or chronic bronchitis, which is associated with irritant-induced airway inflammation. Other common causes are cough variant asthma, non-asthmatic eosinophilic bronchitis, tropical pulmonary eosinophilia, aspiration of foreign body, idiopathic chronic cough, which is diagnosis of exclusion.